Welcome to the Clinical Scribes introductory video for primary care physicians. My name is Kyle Kingsley. I'm a physician from Minneapolis, Minnesota, and I'm the medical director of Clinical Scribes, LLC. Who exactly are we? We pride ourselves on being a cutting-edge, tech-savvy scribe provider for primary care clinics, specialty clinics, hospitalists, and we also provide our services in both emergency departments and urgent cares. We were founded over 7 years ago and have seen explosive growth since that time. It's our feeling that primary care clinics everywhere will have scribes in the near future. Our focus is on reducing provider documentation time with improved note quality. We also pride ourselves on adaptation to the specific needs of our clients. We can deal with any EMR no matter how onerous. What exactly do our scribes do in the clinic setting? Their chief job is documentation. They are masters of documenting the history and physical exam. They can also do limited medical decision-making if needed in the clinic setting, using products such as MedMacros, which is a templating system. They also provide logistical help in the clinic, including obtaining records, following up on lab or radiologic results, and discharge assistance. How exactly are our scribes trained? We have a textbook that's specific to primary care, and this is actually proprietary, not available to the general public. Our emergency department version of the Ultimate Scribe Handbook is available to the public and shown here to the right. This focuses on vocabulary, anatomy, and physiology, and it then goes into the medical scribe role in the clinic. We go into in great depth into medical note. Obviously, HIPAA and privacy are huge foci of the book. We then go into video virtual interactions and shifts, clinic shifts, audio lessons to further improve the vocabulary building. We have written testing, shadowing with trainers, and then competency testing. We also provide recurrent testing and quality assurance for all of our scribes who are working in the clinic setting. So what don't scribes do? Obviously, scribes don't provide patient care. They do not perform any independent medical decision-making, and they are not allowed to help with patients physically or touch patients. They don't stay in the rooms without physicians, and they are absolutely not allowed to enter orders or finalize notes. They also do not write prescriptions under any circumstances. What can you expect as a new user of Scribes? There is obviously an adjustment period as you will figure out the workflow. Essentially, you will have a shadow, and they have to be there to do their job. The scribe should be at your side the entire shift to dramatically improve your documentation quality. You can expect completed or nearly completed clinic notes that will often just require your approval. There may be a slightly altered workflow, as I stated before. You can definitely expect to have dramatically reduced documentation time. This is why we have scribes. You will notice increased productivity, improved patient satisfaction, and essentially improved quality of life on and after your clinic shifts. What do patients think of scribes? Generally speaking, they're very accepting and interested in the scribes. There are exceptions to this. We do have to have a sensitivity to psychiatric issues and more complex complaints. Obviously, genital urinary complaints are highly sensitive depending on the sex of the scribe. But these are just things to think about as you look into moving into the scribe era. How exactly does this work? I'm going to go into two aspects of this: logistics during the clinic and charting. So initially, the scribe is going to follow you during your clinic, and this is a 1-to-1 ratio. They're going to enter the room with you, and you have to introduce the scribe to the patients. Introduction of the scribe to the patients is a great opportunity to actually improve patient satisfaction. Here are some examples, and I'll read these out. This is Aaron. He records for the medical records so that I can focus on you. This is Emily. She is a scribe who helps me write the computer notes so that I can spend more time with my patients. This is Ryan. He's a medical scribe who helps with the computer stuff so that I can focus on patient care. And something that the staff as a whole can use is that we use scribes so that the doctors can keep their patients happy. These all sound very corny, but these have actually been proven to improve patient satisfaction scores, and we all know that that's going to continue to be important in the clinic setting. So logistics during the shift. The scribe will generally enter the bulk of information into the EMR. This can either be a portable computer, or they can use shorthand on paper and enter it into a computer at a workstation. They act as an informal sponge throughout the shift and will be at your side listening to your consultations, discussions with patients, and general interactions with staff, etc. Ideally, they work at a workstation that's very close to you, if not next to you. Generally speaking, for most electronic medical records, notes are then pended for the physicians to sign. Charting logistics. For some charts such as Epic, you can use F2, or looking at 3-starred areas. Our scribes are trained to enter a mark such as 3 stars, depending on your EMR, to denote an area that takes your attention. Initially, it takes a little bit more time to go through their charts, but as you learn how it works with the scribes, this will go much faster. You will look for these scribe marked areas and alter it as needed. Sometimes the scribes, as I mentioned, will use med macros for medical decision making if there's a more complex clinic visit. Also, there is an acknowledgement phrase that must be entered by both the scribe and the physician for all charts that are completed using a scribe. Here are the general acknowledgement phrases. Again, these will be templated and put into your EMR. This is something that you generally won't have to worry about, but you will have to enter the physician attestation phrase. Optimal use of medical scribes, how to use them most effectively. Obviously, more information is better. The more information you give your scribe, the better your notes, the better the quality of your notes will be. You need to be proactive and upfront with your preferences when you work with a new scribe. Continual feedback to the scribes is the only way they're going to improve their performance. And it's vital initially that you are very, very proactive with this. Some time savers. Take an extensive, thorough initial history with the scribe present if needed. You should definitely verbalize your exam findings to the patient, which the scribe can then translate into medicalese. Also helpful to explain the plan to the patient and family with the scribe present. And then also using of walking time between rooms is a great time to explain abnormal findings, plans, or things that you want in the note. Successful scribe users generally are attached to their scribe at the hip. They are great communicators. They're willing to allow slight stylistic issues to slide. They're proactive with their preferences, and they keep nurses informed of the system. One of the problems with using a scribe is sometimes you'll have your scribe very informed and nursing staff falls to the wayside. This is the end of our orientation video for primary care physicians in the clinic setting. We'd invite you to visit us at www.clinicalscribes.com for more information. Thank you for your time.